Hi everyone. Thank you for clicking on the link to watch this training video. This is the first in the series of training videos that we are required to show you this school year. This topic is the nature and relationship of drugs and alcohol to the health and personality development of students and how to discourage the use of drugs and alcohol among students. Drug and alcohol use is a serious concern for all communities in the United States and in Connecticut. In suburban Connecticut communities, the typical age that a young person first experiments with the use of alcohol is around 8th grade. Somewhere around the age of 12 or 13 tends to be the average. And there is a steady increase of alcohol use among young people from 9th grade to 12th grade, with the highest percentage of use reported by students who are seniors in high school. This happens to coincide with the time when most young people are also acquiring their driver's license, which causes an added concern of risky behavior. So it is very important for us as adults who work with these children and young people every day to make sure we're knowledgeable about the information related to drug and alcohol use that can impact our students. When young people begin using drugs or alcohol, they are at increased risk for many problematic behaviors. Some of the ones the one that we're most familiar with is drinking and driving, which can lead to car accidents, which can be fatal or leave someone seriously injured. Other less well-known risks that impact students who begin using drugs and alcohol during their teen years are increased risk of accidental injury from passing out or tripping and falling downstairs, falling out of bed can lead to serious injuries. Students who are using drugs and alcohol are also at higher risk for engaging in violence, which can leave them or someone else seriously injured. And these students are also at risk for making poor decisions when it comes to sexual behavior. And sexual assaults are much more likely if a person in their teenage years is using drugs and alcohol than if they're not using drugs and alcohol. So those are some other very serious problems that can occur. And it's important for us to help our young people to avoid use of drugs and alcohol so that they don't put themselves at risk for those other behaviors. The impact on school functioning with the use of drugs and alcohol for students has primarily two factors that it can impact. One is academic functioning. Students who are involved with frequent use of drugs and alcohol will have a situation that occurs where school is not as motivating to them as it had been, and they become less engaged in their schoolwork. So we'll see a noticeable drop in grades. And another warning sign is more class cuts or more frequent absences from school. So that's something we have to be aware of. The other piece that has a major impact on the development of young people who are involved with drugs and alcohol is their social and peer development. What starts to happen is that they focus their peer interactions in situations that involve drugs or alcohol. And the situations that they find themselves in with peers tend to be risky. Also, those relationships that they have are not meaningful relationships. They tend to be superficial and focused on acquiring drugs and alcohol or using drugs and alcohol. And they don't develop deep friendships. Because of this, their social skill development also suffers, as does their ability to have support from friends who are their age, which is very important for young people to navigate the pressures of adolescence. They have relationships that don't provide much support, and they also don't learn skills for resolving conflict effectively or solving problems on their own. If you notice the warning signs of change in academics, a decrease in grades, more absences, more class cuts, or if you hear information or overhear students talking about the drug or alcohol use of a student in your classroom, please be sure to speak with the student's counselor, the school psychologist, or the school social worker in your school to update one of our pupil personnel service providers about your concerns regarding your student. One of our staff members from the PPS office will then speak with the student and gather more information to find out what the level of risk is and what the seriousness are of the concerns that you have brought forward. It is always important for us to act early so that we can prevent big problems from occurring or serious risk for our students. If you are questioning that a student might have a problem, don't hesitate to seek more information or seek support from a staff member in the PPS office. It is better to err on the side of caution to make sure that we are doing everything we can to support the health and well-being of the students in our schools. And we all know that teachers are the best observers of what's happening day to day with students, and we will count on you to come forward and share any information that you have. Again, if you have any questions about what you should do if you have concerns, please speak with your school principal or a member of the PPS staff. Thank you.